Hi, everyone. I'm Dr. Shatar from the Green Medical Practice, and we're going to have a conversation today. I'll call it the Green Medical Practice Conversations, and we have a special guest today, Dr. Anthony DeNeal. Dr. DeNeal is a chiropractor who had started a long time ago, was in the beginning uh, startup of ChiroOne, which now has grown to 70 locations is it all in the Chicago area?
No, we actually are in 5 states now.
Wow.
Yeah.
So he is in touch with a lot of current happenings in the chiropractic world, and he trains doctors all the time and he's a major influence on their practices. And we're just thrilled to have you here today. And
Thank you. Thank you for having me.
you are so welcome. And right off the bat, I just want to kind of get to the real meaty part of what's going on. Obviously, our focus right now in health and wellness is being really challenged by the current status of our COVID crisis, and many lives are being affected by the COVID-19 pandemic. And so what have you done? What has been your main message that you've been wanting to get out because we're primary care here at the Green Medical Practice, you at Chiro One, we're in a different kind of role, I believe. And I was just wondering how you have approached this new phase in our careers in helping doctors and patients along the way in this kind of time when things could really get out of hand from an anxiety standpoint. So what has been your
Yeah.
focus, Dr. DeNeal?
Well, that's a great question. And what we've had to do, we've had to pivot a lot for sure. Because, first of all, a lot of what we do is hands on. So, the one thing that we had to pivot on is making sure that we were following all of the CDC guidelines when it comes to the PPE. And although we're not working around, blood and different things like that, but it's very important that we do follow the CDC guidelines when it comes to treating our patients. So that was a big pivot for us because it's such a close contact for what we do. And we've done an excellent job in doing it. Our patients appreciate everything we've done, and we've actually grown more. And so here's why we've grown. We've grown because, A, unless you have a death-defying part of COVID-19, you can't go to the hospital. You can't even just walk in the hospital anymore. Same with urgent care. So all of those things are by appointment. So that's going to leave a large segment of the population who suffers from musculoskeletal disorders with nowhere to go. Now, you do have physical therapy that they can go to. You have acupuncture, you have all these different things, but we're such a major part of the communities that currently, which is how we set it up, we're the first place that they go to handle any of their musculoskeletal disorders. So musculoskeletal disorders, just so that way everybody knows what that is,
Mhm.
neck pain, back pain. Those are your common things that you'll see, shoulder pain. So
Mhm.
we handle those things very well, which helps with obviously all of the anxiety. So when you think about the stress that we've all taken on, just knowing that the pandemic, the potential that you can die from this invisible enemy that we have, we've been able to at least ease some of that by helping with that tension in your body. Uh, every nerve, cell, and tissue in your body is connected to your organs, and
Mhm.
that includes your immune system. So along the way, we've been boosting people's immune system by getting them adjusted, keeping them healthy, keeping them educated on how to stay healthy,
That's
so that way we can have all of the people like yourself, all of the MDs, all of our urgent care workers, everybody who's in that realm, they can focus on that group of people and do it at the best of their ability and not get overwhelmed from the system with musculoskeletal disorder. So that's really how we've been helping during this. That's how we've been defined as essential workers with Homeland Security as well.
Yeah, and the vaccine is what's been focused on mainly as an answer, and unfortunately, the availability of it right now is
Yeah,
not all there for everybody. And then there's
right.
some warnings about what some people have had some side effects. So not everyone is going to be eligible for the vaccine. And so there's always a group that's going to benefit from a complete kind of overhaul of their system so that their immune system is boosted. And also there's one of the kind of the silver linings of this pandemic, I believe, has been the fact that it's pointed to some of the shortfalls that our overall culture has been doing. Like, just for instance, of course, we've been trying to tell people not to smoke and to manage their weight and to
Yep.
do all the things that are going to keep them from having these morbid conditions as they grow older. But
Yeah.
now we're able to support them with the same. It's almost like the message hasn't changed, but
Right.
the immediacy of the need, because you, instead of 50 years later, it could be 1 month later, you could be very, very, very sick.
Yeah,
And
exactly. I think now more than ever, as we're seeing it, people are present to their health, and the ones that are unhealthy, yeah, I mean, that is what's going on right now.
yeah, and
And yeah,
I
we'll point out, well, this person was healthy and they died of COVID. Well, you still don't know some of the other underlying things that they may have had. You think that they're healthy because that's what's been reported,
right.
but that is not the case that we've seen. And like you said, we want to be able to
Mhm.
continue to take care of people to the best of their ability and keep them, as healthy as possible.
Right, and one of the comorbidities that you can't see in a person is low vitamin D. I mean, if
Yes.
you Google vitamin D and COVID together, 100 studies come up about the connection between the two, and you can't see that, and you can be a very young person and have very low vitamin D.
Right.
So
You,
there's one
you
right.
pointed that out to me very, very well with my whole family.
Yeah.
Even though that was something that I knew, but not only did you point it out, but we took blood tests to
uh,
even point it out,
right.
right?
Right.
So,
Absolutely.
you're right. You're exactly right. And that is what is going to be an underlying issue that we're going to see going forward.
Yeah. So even if you decide to go ahead and get the vaccine, I still believe that it shouldn't give you a false sense of security, in the sense
Mm,
that you should also pay attention to everything else that's going to keep you healthy. And that's really what's going
right.
to turn things
I
around.
do want to leave you with one thing because you asked me a question earlier, like how do I inspire, these chiropractors and different things.
Yes, exactly.
One of the things that we've all had to learn as chiropractors, and me in particular, because I went to one of the founding schools of uh, where chiropractic was founded. And chiropractic is a philosophy, a science, and an art. The philosophy is what? How you think. How do you think about your body? How do you think about what happens around you? There's a biodynamics that we are all a part of. There's a symbiotic relationship that you have with this planet, with this galaxy. That's
Mhm.
a philosophy, right? Science, evidence based. I mean, the body is the body. No matter who the
That's
body
right.
is the body. So yeah, there's a science behind chiropractic that we all know because we all know how the body works. And then the art, of course, there's an art of how to adjust the spine and make sure that it's aligned properly. That's an art, and it takes a while. So that is what my job is, day in and day out, is keeping these professionals aligned to the mission that we're talking about, how to continue to help human beings discover their full potential, be as
That's
healthy as possible, and meeting them where they're at. So I want to leave you with a quote.
all right.
Uh, and this quote says, "You never know how far reaching something we may say, think, or do today will affect the lives of millions tomorrow." And
Hmm.
BJ Palmer said that. BJ Palmer was one of the developers of chiropractic.
That's beautiful. Very good. Thank you, Dr. Tony. And you take care.
You too. Thank you. Let me know if you need anything.
All right. We'll meet
Okay.
up again.
All right.
Bye bye.
Bye.